Hello, everybody. My name is Krishna Paul, and today I will be presenting our project, Equity in the Early Pain Management of Long Bone Fractures in Black versus White Patients. We have closed the gap. A little bit about myself. I am currently the Clinical Research Coordinator at UTMB Emergency Department in Galveston. To introduce the topic, I want to start with a little bit of background. Patients with long bone fractures often present to the emergency department with severe pain, which is treated with opioid and non-opioid analgesics. Some literature, however, demonstrates that white patients are more likely to receive analgesia over other races, such as a 2008 study where white patients were shown to receive more opioid analgesia than Black patients for conditions such as long bone fractures and nephrolithiasis. Other studies, however, show no significant difference, such as a 2021 pediatric study, which showed that Black versus white patients were given no significant difference in analgesias for long bone fractures. As the US population begins to increase in diversity, health equity also increases in importance. The purpose of our study is to evaluate the early administration of opioid and non-opioid analgesia among Black and white patients in the emergency department for long bone and femur fractures. For our methods, we started by designing a propensity match retrospective study utilizing the Trinetics database. In this database, we extracted from 90 million patients and we propensity matched for age and sex. With propensity matching, we were able to decrease the differences in our population and demographics between our cohorts, which allowed for less confounding between groups. Our setting came from 57 healthcare organizations in the United States at 5-year intervals from 2003 to 2023. Our population included Black and white patients sent to the emergency department for long bone fractures for our first cohort group. And in our second cohort group, we had Black versus white patients sent to the emergency department for femur fractures only. The reason why we decided to do femur fractures only is because patients who present to the emergency department for femur fractures often come in with more severe pain and require opioid analgesia. For general long bone fractures, there are more variations that may or may not require analgesia and therefore may present as confounding. We also created a subgroup analysis from 2021 to 2023, which we evaluated to add to the 2021 pediatric study findings, but also to address contemporary issues at the time, such as the George Floyd case, which prompted concerns for social inequities. The outcomes that we evaluated were early administration of opioid and non-opioid analgesia, which were given the same day or up to 24 hours after the initial emergency medicine visit. For our results, you can see that in the long bone fracture groups, the difference in opioid administration decreased between Black and white patients from 6.3% during the 2003 to 2008 period, which was significant, to 1.1% during 2018 to 2023 period, which was still significant, but trending towards non-significance. The difference in non-opioid administration decreased between Black and white patients from 4.4% during 2003 to 2008, which was significant, to 0.3% during 2018 to 2023, which was not significant. As you can see from our graph, this shows a physical representation of the rate of opioids given to Black versus white patients for long bone fractures after propensity matching. From the 2003 to 2008 period, you can see that there was a large gap. However, as we approach the end of our time period from 2018 to present, which is 2023, we can see that the gap has closed. For our femur fracture findings, The difference in opioid administration decreased between Black and white patients from 4.8% during 2003 to 2008, which was significant, to 1.3% during 2018 to 2023, which was non-significant. The difference in non-opioid administration decreased between Black and white patients from 2.4% during 2003 to 2008, which was actually non-significant, to 0.4% during 2018 to 2023, which remained non-significant. In this graph, we see the rate of opioids given to Black versus white patients for femur fractures after propensity matching. Similarly to the last graph, we see the gap in prescriptions with white patients receiving more opioids than Black patients for femur fractures. However, the gap closed in 2008 to 2013 and remained non-significant to 2018 to present. For our subgroup analysis, by 2021 to 2023, there was no significant difference in the opioid and non-opioid analgesics prescribed for both cohorts being treated for long bone fractures and femur fractures. The patients with long bone fractures had a 0.2% difference between Black versus white patients, which was non-significant. For femur fractures, there was a 0.5% difference, which was also non-significant. In this table, this shows our demographics before and after propensity matching. As you can see, before propensity matching, there was a large difference in both the total population as well as some of the demographics that we matched for. However, after propensity matching, the two populations were very near identical. In this table, this shows the breakdown of the graphs that I showed earlier. However, you can see the percentages more clearly. So for our discussion, the results from 2003 to 2008 were consistent with prior studies showing a significant difference in analgesia prescription with white patient receiving more analgesics. Our results from 2021 to 2023, however, confirms that the gap is closed. Due to the nature of the retrospective study, naturally it would be difficult to establish causation. However, our study generated 2.4 million patients as a sample size, which is over 10 times larger than any of the studies in this current topic to our knowledge. And with that factoring in propensity matching, we had greater power with our results. Also, the increase in opioid prescriptions represented in the graphs were possibly explained by GCAHO policy reimbursing for aggressive treatment of pain and policies which emphasize pain as the fifth vital sign. In conclusion, in the last 20 years, the gap between rates of early administration of opioid and non-opioid analgesics for Black and white patients has disappeared. These are the authors who contributed to making this study happen. These are my image citations. And thank you, TCEP, for allowing me to present this project. Here is my contact information, and you can reach me with this information if you have any questions or concerns. Thank you very much.